Hello and welcome back to Ned's case. Dr. Jerry Cuomo continuing a discussion now as the post-op aftermath of this case turned out to be a very nice case. It was initially an open tray impression of upper 3 implants that were placed in the sinus region. We have Dr. Periodontist from Boca Raton, Dr. John Lindsay, and we also used Dr. Fred Norkin, who's also a periodontist. This case had it, like I said, it was an open tray, and these are modified open tray impression copings that I produced. The company doesn't make them, you have to make them yourself. And so part of this visual right now is to show you how well this case went and why it went so well and easy. Well, number one, you've got to put these in, you've got to make sure that there's enough room in between them, and you've got to lute them together. So within this material, I'm not going to cut this out now, but within it, all 3 of these are joined together, okay, with the same blue material. We used some old diamonds, but in the mouth, you want to lute them together with something like a piece of metal of some type. Okay, then impressions are taken, and then the little analogs that get put on here, these little, what you use for these models. Okay, these are all joined together as well. So you got them joined from the impression, joined in the model. Now you pour your model. Solid model, and you don't want to really cut it out or do anything with it. You need it pristine. You notice your lab's going to cut some troughs on the lingual to make sure that the case is down all the way. All right. So, how do you keep all the parts together? Or even before that, this is just taking some teeth, some ion teeth, and putting some tin foil down on the model first, and then adapting these teeth just to get a rough idea where your teeth are going to go in relation to the implants. Okay, so that set up this case. I didn't do an elaborate wax up. You could do a full diagnostic wax up, but if you keep it simple, I think you're going to go far without all the hassle. Same thing with the lower. Put an ion down there. Make sure you lute it. I'm even going to some of this registration material to hold those pieces in place. Okay, so then you're kind of getting an idea. Okay, well, there's the labial aspect, the outer aspect of where these teeth are going to be, and that looks good. Looks good. Nice position. No, we're not going to try to cheek bite here. And the lower is set up. So you've at least given the lab a headway of saying, okay, this is where I want the teeth, and this is about the average size of the teeth. So they're not just arbitrarily setting them for you. I like to take charge. I like to, not as a quarterback, but just because I'm an integral part of the team. I do have an in-house lab, and they like it when I get involved and I can help them visualize this case. And I also, at chairside, I have a couple of things I want to show you. They're called pill boxes, something simple. You can get it from the drugstore. But what we do is we store all of our parts. And I start with the upper right, and I go all the way to the upper left. So all numbers say 1 through 7. These were the parts used for Ken's case when I took his bite registration, but those are the peak abutments. They all have screws that coincide with them. Okay, and we use these with his case. So you don't want to get them mixed up. Use a pill box. Number it 1 through 7. The reason why there's 7 there is because it's 7 days of the week. Here's a larger one. You put more parts in this one. And you have more parts to take care of during try-ins. So you can use a larger one, or just stay with the smaller one. Smaller version, I think, works pretty easy, pretty well. Okay, so in this particular case, I used 3 on the upper, so we marked them 1 through 3, and then we inserted the peaks into the upper. There they are. I marked the buccal, and they all are cleared. In other words, they're not touching the lower arch at all. And then we take our bite registration. I like this material called it's a jet registration material, and I think it's called President, I believe, President jet registration material. Okay, and then it's full arch because you want to take it full arch. It's important. Make sure that you trim away the elbow in the back. Now, if you look closely enough, you'll notice that there's 3 perfectly impressed areas where you have the 3 bite registration peak abutments. Now, they're hollow here. What we do is we just cover them with some wax. That's all. Make sure they're not hollow. This way you don't have to trim away any of that excess. Now, this goes right in clunk, just like that. I mean, it just fits. Clear all the tissue away. Make sure you don't have the soft tissue touching the bite registration, so that we know that this is a true representation of the patient's bite. And similarly to the lower, just adjust it out so that it drops in. And then hot glue it together. You've got your stick wax bite. You'll know how to mount this case. And we happen to put it on a hinge because we had cuspid guidance coming off of number 6 off a natural tooth. So we're going to take a little bit of that, and then we'll add a little bit to the implants. But I really think that this kept the case very simple, and you saw on the previous videos hardly any adjustment, almost 0 adjustment to do. So case went so well. I couldn't wait to show you, the model work and these little guys here and how they lined up perfectly. And then the case was created from here. So next case, I'll try to show you some more about integrating implants with natural teeth or just complete implants. I'd like to show you also a case where we combine dentures and implants as well. Our office is located in Boca Raton, Florida, and we have an in-house lab that we work with. We also have 2 other labs that we work with. It's very important that you get your laboratories lined up and everybody on board. No one's the quarterback. We all work together as a team, and it just works best that way. And this is Dr. GERARD CUOMO wishing you another good day out there. Here in Florida in the afternoon, we had a little rain this afternoon, but now it's sunshine and good weather going home. So, and that's where I'm going right now. I had a long day, but it was a fun day, and you should too, especially with these platform switching implants. Stay well, and we'll talk to you on the next video. Take care.